we will turn on to the next, how do you say, the country reports. So we will turn to Dr. Lourdes Herrera. She's a Peruvian midwife and now based in Japan. And she is actively involved in the support of immigrant health issues, especially the maternal and child health and the HIV. And I repeat that you can please ask your questions in the Q&A button for the forum after the 3 country reports. And you also can upvote a question. When you think it is very important, please upvote it. So then in that way we know what are the really important questions, and then they can answer it. Dr. Herrera, please, the floor is yours.
Good evening, good afternoon, and good morning. It is an honor to be here with you today to deliver my country report. My name is Lourdes Herrera, as I have been kindly introduced. I am a Peruvian midwife working now at Otemae University Faculty of Global Nursing. And my presentation would be about MCH handbooks to reach vulnerable women in Peru. So here's a brief report of my country, Peru. With a population of more than 32 million people, Peru has a young population. And the key country indicators that you see here for 2010 and 2017 have been improving. However, we still need to improve maternal and child health to have better mortality ratios and rates in the maternal and child health care. Peru is located in South America, and it is a very diverse country. In our country, we have people from different ethnicities. We have most of the population that comes from the indigenous group, and they are descended from the Incas you may have heard about. We have people who are very different, you can see, and also we have different languages. In Peru, the official language is Spanish. However, we use Quechua and Aymara also as official languages. We also have other 42 languages. Unfortunately, Spanish is the dominant language. And I say unfortunately because we have many people who cannot be served or cared in Quechua, Aymara, or any of the other languages that we spoke. And this is due to our geography, which is very rich. We have very diverse climates. We have very diverse territories and beautiful places that unfortunately make also access to healthcare very difficult in some regions like the Andes and the Amazon jungle. Today, I want to talk about the topic of vulnerability. I was wondering who is vulnerable in my country. When we talk about vulnerability, we usually refer to disaster, and mostly we associate vulnerability with poverty. However, we can also find it when people are isolated, marginalized, or underserved. So we can have people who are vulnerable because of their age, because of gender, because of poverty, because of migration, race, and disability. And I want you to take a look at the lower part of my slide here. We see that because of isolation and lack of access to health, most malaria cases in Peru occur in the Amazon jungle. And this is not only because of geography, but as I told you, also because of isolation. We have not enough health centers in the Andean region either. And the mountain regions do not have enough access to health, to water, and to electricity, let alone we do not have access to internet that has proved so effective to reach patients now that we are amidst the pandemic. On the right side of the slide, the lower right part, we have another issue that is also related to access to healthcare in Peru. We have been receiving migrants from Venezuela since 2014. By now, we have more than 1 million migrants from Venezuela who come together with their children. We have also pregnant mothers who come traveling long distances, sometimes on foot, to reach a better place to live. However, we do not always have possibilities to offer them all we need, and I am sure that they are very challenged by their situation right now. To tackle this vulnerability, I want to refer some initiatives. One of them is the maternal waiting houses that have been opened in Peru since 1995. We have some of these houses that also have been used in Asia and Africa with success. In Peru, we try to use the local language and to respect tradition, because many of the people who didn't want to have their pregnancy or delivered cared in health centers referred that it was because they couldn't find anyone who spoke their language or that their traditions were not respected. And we know that birth, delivery, pregnancy is surrounded by tradition. So this is one of the initiatives, and the other also in this slide I want to show you the reaching out activities that midwives and nurses are conducting right now, like teenager pregnancy and postpartum home visiting. We also have online activities that are very difficult in the rural area, and we have midwives and nurses who work in rural areas where we do not have access to any doctors or sometimes health facilities of secondary or tertiary level. And I want to talk today about one of the reasons that make Peruvian mothers vulnerable and families also vulnerable, which is violence. Because of the sanitary emergency, violence has increased by 50% in Peru. We have gender-based violence, and we have many women who die in the hands of their partner due to violence. We also have a problem with violence against children, and the numbers have been increasing recently. The World Bank has also reported that in Peru, child marriage under the age of 18 is happening in more than 20% of women aged 18 to 49 years old. To tackle this problem, the Ministry of Health has implemented a program called MAMIS. This program is taking care of women who are victims of violence, children, teenagers who have been victims of violence. But they need a report from the police or from the judge to be able to access health care for free. This is a very good initiative. However, this initiative takes place only once the violence has occurred and once that they have been able to report it. There is, this would be tertiary prevention, and in the next slide I am showing you, this is an initiative of the Peruvian Ministry of Women and Vulnerable Populations. They reach women who are being affected by violence or in high risk of being violated again, of repeating violence, for children, for women also, through women's centers, through urgent attention of domestic violence and sexual violence. There's also a hotline providing care for them. And here we have that this would be what we call secondary prevention, because in this case also violence is occurring. Now, this is my last slide, and I want to think here about the possibilities for the MCH handbook in my country. First of all, I think that MCH handbook can be effective for the continuity of care of vulnerable populations, for teenager mothers, geographically isolated mothers, migrant mothers. This has been already proved in several countries. And also in the case of high-risk pregnancy and delivery, we can reach mothers through education with the handbook. And in my last, in number 3 here, in the last part, I have written educational tool, because MCH handbook can be used especially to prevent violence before it occurs. We can talk then about primary prevention of violence, not to wait until violence occurs. This would help to strengthen maternal and child health care, and also to improve the care of mother and children in my country. So this will finish my presentation. Thank you very much for your attention.
thank you very much for your presentations and sharing the experiences in Peru. And I think what you indicate, challenges in Peru are, I think, pretty large, as you have also, you are confronted with a lot of diversity around your country and within your population. And well, I think your presentation really illustrates that you do the utmost best to give every child a promising start. So thank you very much for your presentation. And later we will come probably with some Q&A in the open forum. Anneke.
Yes. Now I agree. I think you do a lot of good work. And it is, yeah, you also told us that it is hit by the corona pandemic, COVID-19 pandemic, and a lot of impact on the well-being of parents and young children. And I've seen there is a question for you, but we come to it after the last counter report. But please stay on with your typing in your questions. But